Hi, everyone. Thank you for joining. We are just letting everyone entering the room. Please feel free to present you in the chat. We will begin in a few seconds now. Great. Thank you all for being with us today. So it's the second webinar from the Anticipatory Cash working group. And today we are focusing on the Western Central Africa region with the activation in Nigeria with two great examples and the Anticipatory Cash guideline from WFP. Tomorrow there will be another webinar in French this time, still on the same region, but with Senegal and DRC as a country case study. So today I'm with my colleague Mirko, with the regional representative of the CALP network based in Dakar, and with my partner in crime for all these webinars that you already know, Anita, who is there, working from Anticipation Hub and the German Red Cross, co-leading the Anticipatory Cash Working Group globally, and definitely the person, if you have any question about anticipatory action or cash, and better both, to run through her. So please contact us if you have any question, concern. So we are together for 1 hour and a half. It will be recorded and put on the website. Normally by the end of the week, you will have all the presentation, of course. Please, the idea is to be as interactive as possible. So put your Q&A. We will have that time at the end of the webinar to answer them. We also, if you prefer, you can also use the chat function, at least to present yourself, or if you want to react, you also have the reaction button, so you can also react all along. And at the end, during the Q&A part, you can also raise your hand, and we will make sure that we can hear you. So now I'll give you the floor, Anita, for some global updates.
Hi, everyone. Thank you for joining us today. Really happy to see all of you. Yeah, please do introduce yourselves in the chat. I'm really curious to see who's there, and maybe we even call on some of you during the call if we know you have something to share. Please do also share as you go along anything that you have or you want to showcase as well. Like, this is a place where we really want to try to enrich each other's learning on AA, not just in West and Central Africa, but generally on the topic. So yeah, my name is Anita. I work for the Anticipation Hub. I'm on the coordination team as an advisor on cash and social protection. And like Celine said, I'm a co-chair of the Anticipatory Cash Working Group together with Jose and a core group of members. And you can read about our core group and our working group on the Anticipation Hub webpage. Celine's going to start sharing some links now. On the webpage, you have our work plan, terms of reference, and most of our contacts. We are there for you. Like, we want to really help you, and we want to facilitate your learning and exchange and understanding, and you can join us in a series of different ways. It's also explained on the working group page, like how you can contribute. You can contribute more or less to the working group, from receiving updates of the webinars right through to actually developing content with us, so that we can really try to harmonize and pool our resources and not all be working on the same anticipatory cash training or guidelines and so on. So please do check out that working group page and sign up and join us. And then there's a bunch of other resources that I wanted to share with you that I think would be quite useful. And I believe Stephanie might also share or talk more about some of the resources, because this is her region that she'll be talking about later. So for West and Central Africa, in terms of anticipatory action on the Anticipation Hub, we have a new web page that's just gone up. We'll share a link to that in the chat. We have an anticipatory action task force for Western Central Africa. The contact details are there and the terms of reference are there. There's also a regional roadmap for Western Central Africa, as well as other regions globally. I want to just switch now quickly just to share what I think are some really important key resources for you working on anticipatory action. If you're starting out, if you're new to the topic, or if you're new, working on a new hazard, you can reach out to these coordinators in different regions. If you know, for example, they're working on a hazard or using actions that you also want to work on, and you want to reach out across the regions, between the regions to learn more. Generally, if you can't get in contact with people in the countries via our country pages on the hub, you can reach out to these technical working groups, and they can surely point you to the right people. So we have a bunch of other resources that I just wanted to run through with you. So we have dialogue platforms coming up. The global one, we'll share a link in the chat to the global dialogue platform. You can sign up to join us online. It's 3 days with a whole range of different topics, which I think there's something for everyone in there, from institutionalization of AA and working with governments to working in conflict, forecasting epidemics, all kinds of topics there. We'll share the sign up for that in the chat. I will also share with you afterwards a series of links that can help those of you that are starting off with new hazards, forecasting of new hazards. We recently launched a introduction to the basics of forecasting. It was a 5-part series covering a bunch of different hazards, as well as non-weather hazards, including migration, displacement, conflict, also looking at traditional indigenous triggers. So we'll share the link to that. There's videos, there's webinar, there's a whole bunch of written material on your Q&A. So we'll share that, and we'll also share a community directory on where you can get in contact with people on different topics in the region. Okay, so then the next one slide that that we have up here is, so this is a really, really, really useful resource. This is, every single year we do like a complete sweep, and we ask everybody working on anticipatory action to tell us what they're planning on working on, which anticipatory action plans or frameworks are in place. And we gather the information and we put it in a global overview report, which you can read online, which really describes the latest evidence, trends, work with government, the kind of latest that happened in 2024 was very, very useful. And I use it almost daily. Is you can download 3 Excel spreadsheets. I'll give you an example in the next slide. And in those spreadsheets, you can sort by region. So these are 3 Excel sheets. You can see what was activated, what frameworks are in place, and what's being developed. And so, for example, Celine, that next one, for example, I put a filter in those Excel sheets to see what's being developed in the Western Central Africa region. And you can see here, like what's being developed in the next year, and also reach out to those people and hopefully work together to sort of harmonize, and learn from each other somewhat. We will leave in a bunch of other slides on the different technical working groups under the hub that you can reach out to on different topics, from forecasting to health, and some other key resources in anticipatory action.
As well. Thank you, Anita. I will let you share everything in the chat for all that. And of course, everything will be shared again. And now I'm really happy, and thank you for this global overview. I'm sorry I pushed you.
That was the end of the sentence. Don't worry.
But yes, definitely a lot of resources on the app. So join that. Anita will share some of those resources also in the chat, because I'm sorry, mine were not working as links. And now we will have a presentation with great speaker to go for a bit of deep dive in the region first. So at regional level, we have Mirko that I already presented you very quickly for the CAL part, and also Stephanie, who is with us today from OCHA, in charge of co-leading or co-supporting the Anticipatory Action Task Force at the moment. We after have Magdalene, who will present Save the Children case study in Nigeria. Then we have Federico Barras, who will present the Give Directly study from Nigeria, and we will finished by Uber presenting the new WISP guidance on anticipatory cash. So first of all, Stephanie, who works for OCHA Regional Office for the West and Central Africa. She currently leads the coordination and anticipatory action in the region, including the development of AA framework and the regional AA task force, alongside with other partners. And Stephanie, is up to you now.
Thank you, Celine. Thank you, Anita. Hello, colleagues. Very happy to be here with you today to share a few words on what we do, especially as the Anticipatory Action Task Force for West and Central Africa. So I think we can move to the next slide. All right. So just a very brief overview for those who are not too familiar with what we do here. Essentially, we created but set up in May of this year this current format of the task force, the Anticipatory Action Task Force, which was a result of existing working groups task force on anticipatory action. So we have tried to harmonize everything ongoing under the leadership of SEALS, which is the Permanent Interstate Committee for Drought Control in the Sahel, so a regional government body that also has anchorage in multiple countries in the region and represents all of us on AA at global level. They are supported by a secretariat, which is led by OCHA with great support from WFP and FAO. And we currently have about 33 organizations represented within the task force across the board of NGOs, Red Cross Movement, UN agencies, and donors. And we, for the format, meet on a monthly basis and have ad hoc meetings with technical committees working on special topics to advance our various activities. Next slide, please. All right, so Anita already said we have all our documentation available on the Anticipation Hub website. Very briefly, a few of our key objectives. I won't read it all. I assume the presentation will be shared, but essentially what we are targeting is to strengthen the regional coordination among anticipatory action actors in West and Central Africa. We do a lot on harmonizing capacity building initiatives, harmonize our training packages, and make sure we are all aligned and have the same messages shared with colleagues and partners. We facilitate the identification and sharing of information, all on lessons learned and good practices that we each go through. We also work on integrating anticipatory action into national strategy. This is all the institutionalization agenda and also within our humanitarian program cycle, the HNRP, which is currently undergoing some transformations. We try to do a lot of support on advocacy for funding, resource mobilizations with traditional and non-traditional partners, donors, IFIs, and also to harmonize that. And lastly, on a more technical level, we try to monitor, evaluate, and ensure continuous improvement on everything we do on AA. This includes also developing guiding materials, having overviews of trigger mechanisms, and harmonizing those approaches. Next slide, please. And so all these objectives have been translated into a work plan, which is also available online. We have 4 core objectives on coordination, on institutionalizations, resource mobilization, and 4th objective is again on this more technical aspect in terms of data collection, early warning systems, developing trigger mechanisms, and having a harmonized approach to that. Thank you. We wanted to share a few of the achievements of this task force so far and upcoming activities, which also highlights a bit of the different objectives and that we have. First is we have this year supported Senegal with integrating anticipatory action into their national contingency plan. We're currently working to develop an annex AA plan on floods, which is ongoing through a technical committee. We also had a regional workshop on anticipatory action back in July with key actors from 5 countries in the region, led by WFP. We have a continuous mapping exercise of anticipatory action activities in the region. I do think I have a slide on this afterwards. Talk more on that. And most importantly, what we have ongoing so far is the planning of our regional dialogue platform, which is upcoming next week. This is, I don't have much more information later on, but please reach out if you have, if you want to know more about this. It will be an only in-person event. We have about 130 participants signed up for the event. And we will be reporting live throughout the event and of course sharing our final report afterwards. I also wanted just to emphasize that we do have a lot of activities regarding the promotion of anticipatory action and cash, like Céline mentioned as well. We've had briefings, now these webinars, we have sessions on cash during the platform, and we've also we have a few impact stories that have been written at the global level that can also be shared for those interested. And lastly, also on our effort to harmonize our training material, we have a training of trainers upcoming in November that we entail to roll out during December. Next slide, please. So this is what I just mentioned, the activity on our mapping. This is the current update we have from data gathered up until September. Where you see basically all countries reported on. We have about 40 plans across 12 countries. These have been reported by 8 leading organizations with close to 30 partners implementing and covering, well, 6 to 7 hazard, one being multi-hazard frameworks. This will be coming out shortly as a product of the task force and will be discussed and improved further as we go through the platform as well with partners. Next slide, please. All right, just a few points on anticipatory action and cash. I'm sure most of us are well aware of the themes. We just really wanted to emphasize how it's important within the context of anticipatory action now that we're also in the humanitarian reset, and we clearly see how this modality aligns with our objectives on anticipatory action in terms of acting early, also trusting people to make their own decisions in terms of the beneficiaries, and of course maximizing every dollar that we spend. We all know how it's fast, it's dignified, and we are able to measure the results. And we included a quote from Tom Fletcher, the ERC, really just to highlight how this is at the core of our priorities for what's to continue in terms of humanitarian activities. I'm conscious of time. Let's move to the next. Thank you. Again, we're all probably very familiar with this. These are just some key lessons learned we've drawn from various anticipatory cash implementations throughout the years. We, of course, see how multi-purpose cash is preferred from beneficiaries. But but also that while most useful in the context of AA, it being complementary with other support in kind has proven useful. We all know the need for coordination on cash. This is even more important on AA, especially in this region where we're still trying to map what's going on, who is working on AA, who can do cash, where we can do cash. So we do try to make some linkages on this as we develop our AA plans. Like we've mentioned, and I like the little infographic we had in the beginning with the sunscreen of the after sun upfront investment really pays off and showcases the advantages of cash. Communication with communities must improve. I guess this is across the board. It's even more important on anticipatory action, which, although we all know it and are familiar with it, we need to transfer this this concept that local communities already act on a daily basis, but make sure that we are talking the same language. And lastly, we do put a lot of effort to align anticipatory action with preparedness and humanitarian response, basically in the disaster risk management cycle, where it fits in, how it runs smoothly with everyone else's initiatives. I do have a link here. This is the source from these key lessons learned. It's a paper developed by one of my colleagues from OCHA at HQ. Feel free to have a go at this and reach out if there's anything to add. And lastly, just a few resources in terms of contacts and material you will have for the task force on the leadership front from the SEALs. Martial and Gino, our key focal points. And from the secretariat part, myself, Sylvia from WFP, and Usman from FAO. Should you have any questions or follow-up, please reach out to us and we can link you through to whoever needs to be contacted. And lastly, I think some links have been shared in the chat. These are from SEALS, the Anticipation Hub, and our page on Relief Web as well, where we are trying slowly but surely to make sure we have all our resources available for everyone. I think it's my last slide, Celine. Thank you for your attention, and I'll stay, of course, on the call if we have time for some questions and answers later on. Thank you.
Thank you, Stephanie. Now I can go ahead with some vision from CALP and the Regional Cash Working Group. As many of you already know, the CALP is co-leading the Regional Cash Working Group together with OCHA here in Western Central Africa. Slide, please. So in terms of linkages between cash and anticipatory actions, we see a lot of opportunities here in the region because the region is prone to climate change. There are a lot of different shocks that happens within the region. You see here on the left side the mapping of flooding and also the mapping of the framework on the food security. The region is also very fragile and has also quite a lot of conflicts. So we could also engage more in anticipatory action for related to conflict, movement, displacement, etc. And the regional population is also a population that is really much under difficulties. Right? So in terms of cash used on anticipatory action, here this figure 11 is we have taken from Anticipation Hub. Very briefly, you can see that cash is in the top line, so is the category that has been is used more in anticipatory action. So just for you to understand briefly this graphic, the black line or the dark blue line is when cash is used in anticipation, and the light line is when cash is within the active framework. You see, cash is the first one. And there has been an improvement when you see from 2024 and 2023. There has been an improvement, so cash is being used more and more. Let's hope that this trend will continue also in the next years. Slide. Yes. Okay. Thank you. So why we the added value of anticipatory action? So using cash, as it was also already mentioned by Stephanie, it is really the modality that is preferred by the communities that are assisted, so the community living in crisis. Then what we can see briefly say that also really cash, it is not the only solution. So the last point is cash has to be included together with other modality or other service deliveries. But however, cash can really encourage and enables the vulnerable communities, households, to take steps to prepare for the crisis. So in case of flooding, for instance, cash can really empower the households to move their assets to on safe place, to move also their family to a safer place, etc. It can really reduce also the use of negative coping mechanism. And is really something that can be useful because it can be used within the local market before the crisis happens. The markets are usually functioning properly, so the cash can be really useful and empower also the communities. Slide. So in terms of anticipatory action within the region, here it's a map of the region, so the West and Central Africa. We see that these are always data that we took from Anticipation Hub, 2024 data. We see that in the region we had 6 countries where we had active frameworks, 13 in total within these 6 countries, and all countries have included the use of cash for the anticipatory action response. There is an exception now in 2025, Burkina switched because of the national cash ban, the restriction. So this is the only case where the cash is not possible. Yes, slide please. So in terms of opportunities, we see there are a lot of opportunities. There is a great interest from the cash community. When you see the table in a survey that we did at the end of last year, it was really the priority topic that was mentioned by the cash constituency from the cash working group. So there is a lot of interest from the actors of the cash expert to have more information on anticipatory action. But we have seen also starting with the interaction with the regional anticipatory action task force that there is, as also Stephanie has previously mentioned, there is an increasing interest on how we can use cash also for anticipatory action. There are challenges, but we are also here to work on the challenges. So there is limited knowledge on both sides. So there is limited knowledge of cash between who is doing anticipatory action, and there is limited knowledge of anticipatory action within the cash experts. Limited resources, especially in French and Arabic. Arabic here is maybe useful for local organization working in Chad, and limited examples that are shared, documented from the region. Slide, please. Yes, here I'm not going to spend very much time. I think that those are things that that have already been mentioned by colleagues. So this webinar and also the regional dialogue platform case study. So I think for me it's over here. If you have any question, please drop a question in the chat. Thank you. Over to you, Celine.
Thank you so much, Stephanie, and thank you, Mirko. Very comprehensive, a bit repetitive, maybe presentation, but that's great. You're on the same page. So thank you all for that. If you have questions, please put them in the chat or in the Q&A box, and they will answer that either now by writing or a bit later during the Q&A session. I suggest that we go for to put the spotlight on activation now in the region. So for today, it will be only in Nigeria, but two very, very different activations there. So first of all, the case study from Save the Children, and we are pleased to have Magdalene Kwashi with us today, with the Early Warning System Coordinator with Save the Children International at the Nigeria Country Office. She coordinates the implementation of the Early Warning and Anticipatory Action Initiative across multiple states, supporting community-based risk monitoring, data-driven forecasting, and preparedness planning. Her work focuses on strengthening local systems for anticipatory action and linking early warning mechanism with national and global disaster risk reduction platform. Magdalene, up to you.
Thank you, Celine, and hello, everyone. So I'm going to be taking you through the Early Anticipatory Action Program that Save the Children implemented in 2024. Next slide, please. So for the context of the project, Save the Children identified incredibly vulnerable communities that were prone to flooding year in, year out, which were also vulnerable to the impacts of flood. These communities were also lacking in some knowledge and the ability to implement anticipatory action as well as monitor the risks around them. So the project was specifically aimed at measuring the effectiveness of anticipatory action, specifically the cash aspect of it. And we focused on two themes: anticipatory cash as well as responsive, shock responsive cash. Next slide, please. Now, the anticipatory action trigger mechanisms that we used were, first of all, we used the Save the Children multi-hazard early warning system platform, which has contributors from the government, community members, colleagues, and partners across the country, as well as the hydromet forecasts that are scientific for monitoring risks and hazards within the identified locations. We also had the locally set thresholds from communities. So this was specifically thresholds for every location, and it was unique and peculiar to every community. So it was either the water levels at the riverbanks or trees, or in some cases, the water levels along, certain structures within the communities. So that was the set thresholds, given the historic knowledge and practices of these communities. The pre-agreed activation triggers were from our scientific partners, the Hydrological Services Agency, as well as the Meteorological Services Agency in Nigeria. Next slide, please. To effectively implement the project, Save the Children facilitated the establishment of a committee, which we coined and termed CWAC, Community Early Warning and Anticipatory Action Committees, in 6 communities where we intended to implement the anticipatory action. And their main function was to monitor risks and disseminate early warning information within the community, as well as implement anticipatory action for their communities. And this group comprised of key members of the communities, like the leaders, health workers, school teachers, local government emergency management agencies, partners from NGOs within the locations, persons with disability, and parents of children under the ages of 5. So the approaches we took was, first of all, to build their capacity on disaster risk concepts. We built their capacity on budget management as well as project implementation, and then gave them technical support to develop an early action protocol where they identified their hazards peculiar to each community, identified their local early warning sources. They were able to pinpoint the specific impacts this hazard had on their community and then suggest mitigation activities. Now, for good governance, and because cash was involved, we ensured that they were trained on Save the Children anti-bribery, fraud, and corruption policies, as well as safeguarding policies, so that in the case or in the event of conducting their activities, these policies would guide them. And we jointly drafted a group cash sort of an SOP with the community members, and this guided the activation and the use of the cash that were given to them. So that means that they had to register themselves as a known entity with their local governments. They had to open a joint group account within each CWAC that had at least 3 signatories that would help them access the cash whenever it is given in their bank accounts. And then in the case of financial support, we were able to give group cash support to these committees after they had been fully set up and within all of the standards that were required. This cash was given after they had drafted a comprehensive work plan and a budget, and it was reviewed and approved internally and then disbursed with in tranches to the committee members. We also had the household cash support for vulnerable households. Next slide, please. So under the group cash, we gave a transfer value of 7,200 USD per group. And this was given through their bank accounts, and they were able to redeem it using their checkbooks or withdrawal slip directly from the bank. The cash was given in 3 tranches. The first tranche was given right after their documentations were completed, and the second and third tranche were issued after verification of how the first and second tranche were used and implemented. So this involved them submitting receipts and other source documents, including payments and attendance and timesheets. The cash was unrestricted and conditional. Next slide, please. The household cash had a transfer value of, if you could backtrack, please. The household cash had a transfer value of 66 USD, and that was approximately 106,000 Naira. And this was supposed to cover certain things in the MAB, such as food, non-food items, and transportation in the event that they had to evacuate to safer locations. The cash was given through prepaid cards, and so the recipients were able to get that money from their ATM closest to their locations or the POS, point of sale outlets. Now, every community received an anticipatory cash, but there was a second transfer of a one-off shock responsive cash that was given to 2 communities that showed that appeared to be a lot more impacted by the flooding after it had occurred. So their cash was also conditional and unrestricted. Next slide, please. So the next couple of slides just shows the level of work that was done with the group cash. This is one of the activities that they intended to do. They created their dikes, and it was still standing after the floods had hit. And so this is the first community. If you could move on to the next slide, please. And in the next slide, you'll find another, they had the issue of poor waste management that blocked their complete drainage system. And so in the middle picture, you would see community members implementing the cash for work activities that was coordinated using the group cash support that they received. On the final slide is what the drainage actually looked like after everything had been cleaned up. Next slide, thanks. So to some of our achievements and accomplishments and some of the lessons that we learned through the group cash is there was a significant improvement in how the communities were able to coordinate themselves and carry out preparedness activities before the forecasted flooding. And they experienced and they actually showed a better ability to clean their surroundings and just conduct more wash-related activities. And some of the challenges we experienced anyway is that we didn't plan adequately for how to sustain and manage those structures that they constructed, because apart from the clearing of the drainages, they constructed structures like latrines and TLS, as well as bathing shelters in the safer locations where they relocated to. So we didn't plan adequately to support that. Next slide, please. And then for the household cash, there was significant reduction in stress levels from community members because they had the money beforehand to be able to cater for themselves, provide for food, and ditch all the negative coping strategies that they were practicing beforehand. And for the households who received both the anticipatory cash and the shock responsive cash also recorded a significant increase in their household income level, because they were able to continue to set up their businesses and support themselves in one way or the other. The challenges experienced in the household cash area is the insufficient amount that was given to them. The 66 USD was not sufficient, especially for those who received only the anticipatory cash, because it was not enough to take them back to relocate to their places after the flood occurred. And then a few beneficiaries also reported shortage of cash. When so many people are withdrawing money at the same time in the same locality, it puts a little bit of strain on the physical cash available within the community. Next slide, please. And so in 2025, the adaptations we took was that there is a national anticipatory action framework that was jointly developed by the governor, by the Office of the Vice President, as well as key partners. So that was what we used to activate anticipatory action for 2025. And this time around, we used mixed cash modalities to give out the cash. So we gave cash at hand to a certain number of people, and then we gave the cash directly into bank accounts of certain people, depending on what the community members preferred and the security context in each of the communities. And the transfer value was increased by 100% this time around. So households received over 200,000 naira to support their anticipatory resettlements and plans. Next slide. So the next couple of slides just shows you a snapshot of the framework that we used. We made use of the Google and the GlowFast to trigger anticipatory action. The next couple of slides, and then that would be it. You can go over it and see. So thank you very much, and thanks.
Thank you so much, Magdalene, right on time. So thank you for all that. You also have the document that I will put in the chat. Sorry, I don't know what the link was not working right now, but I'm pretty sure that I will get some help with that. And now we are still being Nigeria, still in 2024, and I will give the floor to Federico, who works at Give Directly Humanitarian Global Team. He has been working on cash assistance, disaster response, and disaster risk reduction for over a decade. Currently, he is the main anticipatory action focal point at Give Directly and has worked in anticipatory cash project in Bangladesh, Nigeria, and now Kenya. Federico, it's to you.
Thanks, Celine. Just checking that you can hear me loud and clear, as I've been having some issues with my connection today. Thank you.
Perfect.
Hi all, I'll try to keep it short. I'm Fede, a humanitarian manager, as Celine said, at Give Directly, and I'll be talking about how we used AI and historical flood data to deliver cash in Nigeria last year in October 2024, before floods hit. Next slide, well, 2 slides ahead, please. Thank you. So very quickly, for those who don't know Give Directly, or GD in short, Allow me to give a quick intro of our work. We are an international NGO that sends cash to people living in poverty or affected by shocks, no strings attached. Since 2009, we've delivered around $900 million to 1.9 million people in 12 different countries. Next slide, please. Unlike most NGOs, we don't have several lines of action, but we are cash practitioners. We only do cash. There are many different ways in which we use cash, from universal basic income programs to livelihood support or rapid response. But today, we'll be talking about anticipatory cash for flood preparedness. Next slide, please. Yeah, we've been talking about AA. No, just the previous slide, 1 second. We've been talking about anticipatory action for a bit. And I understand that probably everyone here knows what AA stands for, but let me just quickly share the definition of anticipatory action that I like most. Anticipatory action is actions taken to reduce humanitarian impacts of a forecasted hazard before it occurs or before its most acute impacts are felt. So the decision to act is based on a forecast or collective risk analysis of when, where, and how the event will unfold. Thanks. Next slide, please. Give Directly, since our early years, we are an organization that likes grounding our work in research-based solutions. So we started to focus on AA after seeing the evidence showing that anticipatory cash reduces negative coping strategies, improves food security, health and economic outcomes, and makes communities better prepared for shocks, like our colleague Mirko was alluding to earlier. And now we know that it's also cost effective. I'm sharing here a very interesting insight from a WFP FAO study that showed that for every $1 spent on anticipatory action, we can save up to 7 in reduced emergency response cost and economic losses, which I think is very relevant for the time we live in terms of funding. So in the year 2022, we started partnering with Google Research and other partners to look for ways to distribute anticipatory cash to those affected by floods. Our first pilot was in Mozambique, and since there we expanded to other countries like Bangladesh or Nigeria. Next slide, please. Our approach to anticipatory cash is outlined here in 4 simple steps. First, we do geo-targeting and pre-enrollment. We utilize historical hazard maps, poverty data, infrastructure data, and others to identify where the most vulnerable communities to the hazard are. Once we've selected the target areas, then we start pre-enrolling households remotely or in person. I use the word pre-enrollment because the fact that a household or a beneficiary or potential recipient is pre-enrolled doesn't mean that they will be getting assistance. It requires, obviously, the trigger activation. We also work on trigger design. We have partnered with JBA, which is a UK-based hydrological consulting firm, and with Google Research. And we design highly localized forecast-based triggers. Google AI-powered models like FlogHub provide us a more granular prediction than what others are able to have in the field. I think some of our colleagues like Save the Children are already starting to work with these forecasting systems that through AI, I think, bring a lot of nuance to the field, and that might set a new era for anticipatory action. We also obviously value a lot local engagement and partnerships. We not only engage with local communities, but we also are set partnerships with NDMOs in the countries where we work. For example, in Nigeria, we work closely with NISA. Finally, we have our 4th step, which is trigger calculation, early warning, messaging, and payments. Next slide, please. This is the last slide to explain how we do AA work, which is just an explanation of how, an example of how we set triggers in a particular context. In this case, this is Bangladesh. So we have an API that our partner JBA uses with Google Flood Hub, through which they receive daily hydrological forecasting. They produce, based on this, inundation maps that allow us to identify potential flooding and the areas that this flooding would cover. So JBA's model analyzes how many people would be affected by a forecasted flood event. In the cases of Bangladesh and also Nigeria, we set a flood for us to have activation in mind at a 2-year return period flood event. Finally, if thresholds are met, could be 75% of people affected by the flood, or lower, like the case of Nigeria, where we had a 20% of the area affected by the flood. If triggers are hit and also thresholds are hit and triggers activated, we start sending cash to people after a quick validation check. The validation check is usually checking the locally led or the locally owned early warning systems, FFWC for the case of Bangladesh, and then NISA for the case of Nigeria. 2 slides ahead, please. Well, now let's talk about Nigeria's case. So last year, we used Google's historical flood data in the southern Kogi state, where the Niger River crosses, in combination with relative wealth and other data, as I explained before, to identify most at-risk communities. We didn't just identify Ibaji as the most at-risk local government area, but thanks to the granularity of the data that we have from Google, we were able to go down to the ward level. Combining all of this with local knowledge, we ended up targeting the 6 most at-risk wards within the local government area of Ibaji. We will see later how this sort of geographical targeting, how accurate it was compared to the flooding that later happened. The result is this map that you see on the right-hand side. And by the month of July, we started to enroll potential cash recipients. Next slide, please. Yeah, so we used Google's forecast tool called FloodHub to monitor flood forecasting on a daily basis during the flood season. We started around mid-August. What you see here is an inundation map generated by our partner JBA, who supported us with the trigger design. The pink polygons are the target areas, and the blue color is the forecasted flood footprint for the next 5 to 7 days. So once thresholds were met, we triggered anticipatory cash transfers during the months of September and October. We were able to distribute cash from 48 to 72 hours after trigger activation. And we ended up distributing cash to over 4,500 households before flood peak, which according to NISA took place on the 22nd to the 23rd of October. And we also, like our colleagues from Save the Children did, we also sent a second post-shock transfer mid-November. Next slide, please. As I was saying also before, we live in times when making the most out of every dollar is essential. And we're always looking for ways that are cost-effective to implement programming. In Nigeria, we did remote targeting, which saved us $80,000. $80,000 allowed us to enroll an extra 250 people to this project. And then I have also here some data on what people did with their cash. When I visited the project last year in Nigeria, end of October, I saw firsthand how people were using the cash to better prepare for the floods. Some of them used the money to build bamboo rafters, protect their crops, their most valuable belongings, and others directly spent it to evacuate their households and establish temporarily in higher grounds as preparedness measures ahead of the peak, which happened a few days later. Most of them used part of the first cash or the anticipatory cash transfer to purchase medicine and food. Thanks, Celine. I'm almost done. This is my last slide. So I was saying before how, if you go to the next slide, sorry. I was talking about how we did our geographic targeting and pre-enrollment based on historical flood data. And now this slide is showing us how our historical data geotargeting worked. On this post-flood analysis done by OCHA, Ibaji was the highest, or had the highest number of affected persons of the whole region, of the whole Kogi state. I think that obviously this is just what's the word? It's not like sufficient evidence. This is anecdotal, but we're more and more seeing how utilizing historical data and combining it with local knowledge, which is what we did, really helps identifying where floods and other hazards are more likely to happen. Thank you. Thank you, everyone. I think I'm under the 10-minute mark. So over back to Celine.
Yeah, amazing. Thank you. It was really informative. And yeah, I learned a lot again, even if I know the case study. So please share, both of you, the case study. Thank you, Fede. Thank you, Magdalene, for all that. I see already quite a lot of questions in the Q&A box in the chat. So please continue to go on that. And I suggest that now we are moving from something like regional focus to very country focused and even even more focused than that. And then we go back to something a bit more global. So each time we are doing a webinar, we just want to make sure that you are aware of the new tools, guidelines, etc. And recently, WFP have published a guidance about anticipatory cash, and we find that it was super useful. So we really want to have that presented to you. So with us today, we have Ube Sekades, who is also part of the Global Anticipatory Cash Working Group, and she has shared that with us quite a long time ago, and we find that it's pretty amazing. So she is with us today to present that. She is the Anticipatory Action Program Manager at WFP, leading on all the thematics on anticipatory action and cash, social protection, and evidence. And Ube, I leave you the floor.
Super. Thanks a lot, Celine. Hi, everyone. I'm the last speaker, so I hope to engage as much as possible before getting into the interesting stuff, which is the question and answers. So if you can go to the next slide so that we can share with the group here. That's a bit the scope of work we have right now in WFP as anticipatory action. So we're working in over 44 countries, right? So we're working in Western and Central Africa, but we're working globally. And we're covering around 6.2 million people with anticipatory transfers, out of which 99% are cash transfers. We're not so much doing in-kind food yet. So it means we are working with very different designs and settings and operations on cash delivery for different types of hazard across the globe. So if we can move forward. So then we actually started writing this with our cash colleagues, because I come from the AA side, even though I was back in the field before and I had to implement cash as WFP implements cash. So we merged the two types of knowledge, right? The anticipatory action knowledge, which I think we've seen throughout this presentation and experiences from the activations that they were sharing with Nigeria, Bangladesh, etc., and then merging it with our best practices on cash operations. And so this guidance was published, and then we initially was published internally and then externally. And the idea was to frame this so that we could reach the scale that we wanted to, and also to make impactful operations, right? So we did some key considerations that I'm going to run you super briefly through, and then we sort of organize the thoughts around what are the key steps that I need to go through if I need to develop and design an anticipatory cash operation. So we design it in these like where, who, what, how much, when, and what works type of way, so that anybody, whether you had a lot of experience on AA and nothing on cash or the other way around, could speak to both audiences, because sometimes it's about translating from different types of audiences. Next. A bit in terms of the preconditions with the cash. So basically this guidance was to frame the design of the cash intervention. So you would sit down and be like, what would be the transfer value? Who's going to be our financial service provider? How many people are we meeting? Like all these different elements that actually design your cash intervention. And then how do you protocolarize all that? Who is going to do what, when? Because when we talk about anticipatory action, we don't have the time to start thinking. We go ahead once we trigger. There shouldn't be any doubts. It should be a go type of work, right? So the SOPs would be internally for WFP, but also with the different financial service providers and cooperating partners. And then, of course, we act, we monitor, and we measure the evidence. Next one. In terms of a bit the preconditions, if you click so that everything comes up, please, so that I can go faster through this whole thing. So I know it sounds quite redundant and quite obvious, but it's insane how many times we just sit in our offices without talking to the people we will be assisting, right? So throughout the whole guidance, we keep saying, talk to the people you're going to assist, understand what their needs are and their preferences are, because that should inform the type of analysis, right? If you don't know that, you're already missing quite an important precondition. The anticipatory action plan that tells you from the triggers and the thresholds that our other colleagues were explaining and activations to why are we doing this should be in place and approved by all the stakeholders, so not just by one partner, but everyone. Then we should enforce sufficient capacities and resources, meaning staff, time, and funds, which sometimes it's the same person doing 7 types of jobs in the field. So we wanted to make sure running an anticipatory cash operations in a very time-constrained window, it's not a one-person show. Then the different corporate processes to be able to do cash in WFP and the places we work. Of course, you need to trigger. The funds need to be pre-arranged and available. And then we've always said, do not do anticipatory cash in isolation. Most of these countries, we have other operations. So try and integrate as much as possible with either other emergency operations or other longer-term resilience-based food security programs. Next, that's a bit the precondition. Then, I mean, you can run through the different steps and the guidance in itself, but I think everyone gets very excited somehow on the magic of how we define transfer values. And the spoiler is there's no off-the-shelf transfer value. There is no magic solution to one type of transfer value, not even in the same country, right? So you need to understand what are people's needs in the forecasted shock and emergency that might unfold, because their needs will change from their regular needs, even if it's already quite dire conditions that they live in. Understand them, talk to them, and then define what is the gap. We have a gap approach in WFP to define in the transfer value. So how much, what would be their needs, and then how much can they afford, and what's that gap that you could cover, right? That should set up your ideal transfer value, the minimum expenditure basket. I'm sure most of you know about this. So it's nothing mind-blowing. It's more about understanding if it's a flood, if it's a drought, it will probably be different. If you're trying to cover life-saving versus livelihood protection objectives, the transfer value would be different, right? So we've included some examples in the guidance on you know, the range that it can be. And we have a huge range of different transfer values, and there's not, just because it's smaller or higher, it doesn't mean that it's better. It has to be tailored and really aim for the impacts that you've defined in the first place. Next. Something quite important is do coordinate with the other partners. I think we've seen here, you know, Give Directly, Save the Children, we have CALP, we have the government and stuff. And, you know, what is out there already? What have we used in the past in other emergency responses? The governments. You might have an ideally beautiful design transfer value within your own office, and the government's like, no, that's it. It's going to be half of it, because then it creates a whole economic problem, it creates a whole social cohesion problem, or simply they don't want to, right? So you need to have that buy-in, you need to have that clear communication across all the different stakeholders. Next. Something we've just, and this is literally yesterday, I was doing the webinar of this, so we've just presented this element, which was a bit of a blind spot as we've been growing on AA Cash. And this is combining the economic and market analysis that WFP does for food security in general to our anticipatory action plans. I think Mirko mentioned markets are reasonably stable before a shock happens. Yes, and our AA operations rely on those local markets. But even though they might have not been disturbed by the actual hazard that we're forecasting, they might be disturbed from other economic or market considerations that we monitor, but sometimes we don't speak to the people that do this analysis, right? So it's important to understand what are those pre-shock market dynamics that run in the context in which you're going to activate to make sure that we maximize the funds that we transfer, to make sure we protect people's purchasing power, because they can be impacted. And it could be that we're seeing, we're given $100, and then because of inflation, because of prices rising, because of seasonality, they can only buy worth $75 or $85, right? And then we don't see so much impact when we do our evidence. Next. So this slide is just for you to look a bit on an insight of what this other guidance has. But basically, you would ideally want to have a threshold for reviewing your transfer value, right? In WFP, it's about 10-15%. So if your country or your area of the country is running a 10 or 15% price increase or inflation, you might want to look at it before the hazard season or before you activate if you have the time. Then you calculate the price increase, you compare the threshold and the price increase, and then ideally you adjust. It's not easy. It won't always be something to do by default, but at least it's a more informed transfer value, because it could be that we have a long time between when we design these frameworks and then when we activate. We're talking about 1 in 3, 1 in 4 year return period. So, just bringing a bit of light into these blind spots. The considerations are for you to consider. Could be things that are completely outside of our control, but things to actually discuss within your teams, cross-functional, and then adjust to deliver and maximize that impact. Next. Frequency and timing. If you can go to the next one, which I think this is quite obvious. When do we give cash and how often should we give it? It depends if you're talking about sudden or slow onset. Normally, it really depends on the forecast accuracy, on the context, on the lead time, and then if you can go to the next one. And then mostly, when we're talking about sudden onset, no matter how much the scientifics tell us, oh yeah, it's 7 days for a cyclone, no, you really will only have 2 or 3. So it only really allows us for 1 cash transfer. Where you can have a different conversation on the timing and the frequency is on the slow onset, right? Again, whether you do a lump sum or you do, I don't know, 3 months worth of cash transfer into one, or if you do 1 every 3 or every 2 months, or it depends on, again, security, social cohesion, objectives, liquidity. Like there's many, many different considerations that that cash practitioners know about. Next. Maybe to wrap up, so I've been throwing to you quite some food for thoughts. We're running into challenges, and we're quite open within WFP and nothing within the AA community to speak about these different challenges, right? The reach and the scale of anticipatory cash for sudden onset is quite different for slow onset. Sudden onset, you need to have, if you want to reach a scale, you need to have these people already registered. You need to know where they are. These increases in costs, right? So how can you balance of the costs and the speed? In slow onset, this registration happens probably most likely after a readiness trigger, and so there might be delays. And so, how you balance again the speed and the accuracy and the costs associated with that. Digital solutions tend to be the fastest epic versions, but they're not available everywhere. So, again, to ask people what are their preferred solutions. And then obviously stay aware for any potential restrictions and adjust as much as needed, whether it comes from the government or from the financial service providers or any other potential restrictions that might be there. Then in our case, advanced financing is quite an issue. If you don't have the funds prior to, it's very hard to do very, very fast operations, and therefore we run into the same delays that a normal humanitarian response would run into. So more than happy to discuss further into challenges as we move forward. And I'm just going to leave you with the last and final slide, which is some case studies, not from the region, but from across the globe on if you're interested on how we've designed different cash operations in very different contexts, from fragile contexts like Haiti to very government-centric options with the Ministry of Finance in the middle in Fiji for anticipatory cash. Bangladesh, our biggest and fastest cash operation, thanks to digital money, and then a financial service provider that's amazing. And then in Mozambique, that has gone through 3 cyclones and has activated for 2 droughts as well, and lots of learnings there. So yeah, that's it. At the end, you have a bit of an advocacy piece from OCHA on the importance of anticipatory cash, and that we all advocate on this. And I think I'm going to leave you there. Sorry, I was running quite fast, but I wanted to give you as much as possible. Over.
No, thank you so much, Ube. It was super nice. So definitely you have the WFP guidance that is available, and yeah, please now shout out all your questions, and I think Anita will make sure that all the panelists will answer the question. So we have now a bit of time to go through that. Anita, I leave you the floor to facilitate that. I've seen quite a lot of answers already in the chat. So if you want to raise your hand also to ask for more questions, yeah, let's do that. And I suggest that we shortly cut the recording, Sophie.
I will just ask Mirko maybe to say one last word before we wrap up, and Mirko on anticipatory action or anticipatory cash. What would be your top tips?
Thank you. Yes, thank you very much, Anita, for facilitating this, and thank you also for this question. I think I liked very much all the presentation today. So in my reply, I'm also going to use something to wrap up. So I think it's the first thing is that we see that cash is already, there is already quite a good interest on cash for anticipatory action within the region as well. But as we have seen, also quality matters. Quality matters because also we are in a context where there are no enough resources to cover all the needs that we have within the region. So we need to explore different possibilities. I think I like also the use of technology that was presented by Federico, but also I like some of the things that were presented by Urbe on WFP, on analyzing also the transfer value, how we can really make sure that we do adapt to each context this intervention, because this is also for me very important within this region. Anticipatory action, it's need also to be adapted, because if we want really to respond to before the crisis hits, we really need to prepare in advance. So we really need to focus our work on the preparation. We do not have just to work after, but we need to act appropriately. We see that also today were shared many different tips on how we can do it. So explore those are very important, I think. And finally, even though there could be many others, I think the coordination is very important. What we are doing today also is very important. Share good experiences, share also what is not working so that we can learn from it, we can improve. I think many times we tend to share what does work or what has functioned well, but we should also focus on what are the limitations so that we can improve. We can take the next steps in order to say, okay, next time it will be better. In the region also, sometimes also when I go to Europe, sometimes it's very difficult also to see also when I watch the news, to see when there is also some heavy storm coming. So where we have also high technologies is already complicated. In Western Central Africa, this technology is very less present than in other contexts. So it's another additional burden that we should see how we can all together find specific solutions. I hope this have answered what you were expected, Anita. Thank you very much again for all the presentation. That were for me a very brilliant presentation, starting from the general one from Ocha, Stephanie, but also the presentation from Magdalena, Save the Children, Federico, and also Urbe. I like it very much. There were a lot of things. Unfortunately, we don't have a lot of time, but I wanted to share a few different things. For those of you, for the French speakers that are interested to follow, tomorrow at the same time as of today, we will have another webinar with French-speaking presentation. So there are different presentations, different learnings, one from DRC Congo and one from Senegal. So please join us if you are interested to follow also this presentation. I'm really happy, and I hope to see many of you at the next week dialogue platform that will be held in person in Dakar. So hope to see many of you there. And as also Anita has shared in the chat, please feel free to enroll for the global dialogue platform. It will be also online, so feel free to share it and stay in touch in all different ways. You have also different contacts that all the different presenters have shared. If you want, please stay in touch with us at CALPA, with Ocha, with Anita for the Anticipation Hub, or with all the presenter. So let's build on this community so that we can improve our common work. Thank you very much, and I hope to see you also soon.
Thanks. Ciao.
Thank you. Bye-bye, everybody.
Thank
Thanks
you.
for joining
Bye.
us.